What if I told you that age does not decide your vitality, but your daily signals do, and that a single minute under warm water can send the right signal to your body every day? For years, many men have been taught to believe that time reduces energy, circulation, and confidence. Yet the body you carry is far more adaptive than that story allows. It responds to clear, simple inputs. Heat, breath, gentle pressure, and a touch of mindful attention can wake up tissues that have been tight, quiet, or neglected. Today, I want to guide you through a 1-minute routine in the shower, a pelvic massage designed to support circulation, soothe tension in the lower core, and help many men feel steadier, lighter, and more confident in their intimate well-being. You won't need any special device. You won't need to remember long sequences. You just need warm water, your breath, and a precise way to place your hands. Before we begin, understand the idea behind this practice. The area we call the pelvic floor is a hammock of muscles and connective tissues that attach to the front of your pelvis, the sit bones on each side, and the tailbone behind. These muscles help support urinary control, posture, and the subtle balance between relaxation and activation that influences how you feel in your core. Modern life asks you to sit for many hours, hold your breath when you concentrate, and clench your abdomen when you're stressed. Over time, tension can collect in the hips, lower abdomen, and the perineal region, the space between the base of your genitals and the anus. Gentle warmth plus mindful pressure can invite those tissues to release. When they release, blood vessels have more room to widen, nerves communicate with less noise, and your body reads a message of safety instead of alarm. Safety opens the door to better circulation, calmer digestion, and a sense of grounded confidence that many men describe as, "I feel more like myself." Your minute in the shower starts before you even touch the area. Let the water run warm, not scalding. Warmth relaxes the smooth muscle in vessel walls and softens connective tissue so it will respond to your hands. Stand with your feet hip-width apart and bend your knees slightly. Drop your shoulders. Place one hand on your lower belly and one hand on the small of your back. Take 3 slow breaths. Inhale through your nose so your lower ribs expand in all directions. Exhale through your mouth as if you were fogging a mirror. Each exhale invites your pelvic floor to soften a little. These first 3 breaths change the chemistry of the moment. They reduce sympathetic tension, the fight-or-flight tone that tightens muscles, and give you control over your pace. Now you will use your hands for a brief, focused sequence. The water continues to warm the surface. Your breath continues to keep you present. Slide the fingertips of your lead hand to the lower belly, just above the pubic bone. Press gently toward the spine, not down. The goal is not to poke, but to sink, like pressing into a dense sponge. Hold for 5 seconds and release. Repeat once. What you are doing here is reminding the layer of fascia that covers your lower abdomen to glide again. When that layer is supple, it stops tugging on deeper attachments that influence how the pelvic floor reacts. Next, move each hand to an inner thigh where the adductors live. These muscles anchor on the pubic bone and often hold tension that transfers into the pelvic floor. Make a C shape with thumb and fingertips and squeeze the soft tissue of the upper inner thigh as if you were wringing out a towel. Gentle, rhythmic, never painful. Sweep upward for 3 slow seconds, release, and repeat twice. Imagine you are allowing warm water to deliver circulation from the thighs into the central core. You're creating a gateway for flow without brute force. Now you will address the perineal region itself with utmost respect and gentleness. Bring the pads of 2 or 3 fingers to the center of the space between the base of the genitals and the anus. Do not press on sensitive structures. You are aiming for the soft area in the middle, not the bony edges and not the testicular tissue. If you are unsure, reduce pressure to almost nothing and simply feel warmth for a breath. Then add a slow, light pressure directed up and slightly forward toward the pubic bone, as if you were lifting the tissue rather than poking into it. Hold for 5 to 10 seconds, paying attention to your exhale. Many men feel a subtle melting sensation when they exhale. That is the release you are inviting. Ease off, rest for a breath, and repeat once more. The intention is to soothe the fascia and small muscles that often grip without your awareness. A calm perineal region helps the pelvic floor coordinate better with the diaphragm and the deep abdominal wall. If you have another 20 seconds, add a gluteal sweep to complete the ring. Slide your fingers to the crease where the buttock meets the thigh. Use the flat of your fingertips to make small circles along that line on each side, 3 circles per side. You are tracing the path where many nerves and vessels pass and where tightness can reduce glide. Small circles here can take pressure off the back of the pelvis and relieve a tug of war that the front often loses. Finish by placing your whole palm over the lower belly again. Take 2 slow breaths. Imagine the breath traveling down to the pelvic floor on the inhale and lifting gently on the exhale. That image is not fantasy. It mirrors how the diaphragm and pelvic floor move together. The full routine takes about 60 seconds once you are familiar with it. Warmth, breath, lower belly release, inner thigh sweep, perineal lift, gluteal circles, and 2 breaths to end. That's your 1-minute practice. It is discreet, simple, and repeatable. But it is not a random massage. Each contact serves a reason. When you soften the lower belly fascia, you reduce a forward pull that can keep the pelvic floor braced. When you sweep the inner thighs, you calm muscles that talk directly to the pelvis. When you lift gently at the perineum, you invite a coordinated relaxation that improves local circulation and comfort. When you circle the gluteal crease, you ease tension on the posterior sling that shares tasks with the pelvic floor. And when you breathe at the end, you seal the message. This body is safe. This body can flow. You may ask why such a short routine could matter. The truth is that your body listens to frequency more than intensity. 1 minute, repeated daily, teaches tissues to reset. Vessels receive regular shear stress, the friendly kind that nudges the inner lining to release nitric oxide, the molecule that encourages vessels to dilate. Nerves register touch that is calm and predictable, which can lower the background noise of threat associated with chronic tension. Muscles stop treating the pelvis as a zone to guard and start treating it as a zone to coordinate. None of this requires pain. In fact, pain is a sign to reduce pressure immediately. This is a soft tissue conversation, not a forceful negotiation. Consistency will bring the first changes in subtle ways. Many men notice that their lower abdomen feels less bloated after showers, even if they did not change what they ate. Some find that sitting for a long meeting no longer produces the same dull pressure in the perineal region. Others discover that walking feels smoother because the hips swing more freely. It is common to feel warmer in the hands and feet after a few days, not because the shower is hotter, but because circulation is more responsive once the pelvis is less guarded. Over weeks, better pelvic coordination can show up as steadier urinary control, more complete emptying, and fewer urges driven by tension rather than real need. And because the pelvic floor is part of your posture, some men report that the lower back softens, as if the body finally agreed on a neutral gear. Let's take a closer look at why breath matters here. When you inhale, your diaphragm lowers, pressure shifts toward the abdomen, and a healthy pelvic floor responds by lengthening slightly as a counterbalance. When you exhale, the diaphragm rises, and the pelvic floor gently lifts. Many of us reverse this rhythm under stress. We inhale and brace, exhale and hold. The 1-minute routine is a daily chance to restore cooperation. If you struggle to feel it, try this micro cue at the end of the massage. Whisper the letter S during your exhale for about 6 seconds. That slow release activates your deep core without clenching your outer abs. The result is a more balanced pressure system, which your pelvis appreciates. You may wonder if this is safe for everyone. Most men can practice this routine comfortably. If you have a skin condition in the area, active infection, recent surgery, severe pain, or any concern about a hernia or a vascular issue. Skip the massage until you are cleared by your healthcare professional. If you feel sharp pain or numbness at any point, stop and lighten your touch. The rule is simple: no pain, no forcing, no rushing. This is a minute of respect for your body's architecture. What about tools or soaps? You don't need any. Warm water is enough. If you prefer, place a warm washcloth on the perineal region for 10 seconds before the gentle lift. Avoid scrubbing. Avoid fragrances that irritate. Let warmth do the heavy lifting and let your breath guide pressure. The more precise your attention, the less pressure you need. Precision beats strength here, every time. Because this video is about intimate well-being, let's connect the dots without using explicit language. Circulation in the pelvic region influences how confident, calm, and responsive you feel. A floor that is too tight can send mixed signals: urges at the wrong time, fatigue that you read as low energy, or a sense of heaviness that you interpret as aging. Releasing the floor does not weaken you, it frees you. The strongest muscles in your body are also the ones that know when to let go. Think about your grip when you carry a bag. If you never unclench, your hand becomes useless. The pelvis is similar. A skilled system alternates between support and ease. This 1-minute routine trains that alternation gently. Let me walk you through a day so you can imagine where this fits. Morning. The shower is warm. Your mind is already listing tasks. Before you let thoughts carry you away, you practice the sequence once. By the time you finish, your breath is steadier and the lower belly feels lighter. Afternoon. A demanding day has you seated for hours. When you get home, your second shower becomes your reset. Same sequence, same minute. You do not have to do it twice daily. Once is enough to start, but repeating later can calm the system after stress. Night. You lie down and notice your breath traveling lower. That is your nervous system thanking you for telling it that the center is safe. This routine pairs well with micro habits that take almost no time. If you want to multiply benefits, consider 2 that integrate naturally. First, drink a glass of water after the shower. Hydration supports blood volume and helps your vessels respond to the signal you just gave. Second, add a 30-second hip opener. Stand with one foot on a low step, bend the front knee, and tuck your tailbone slightly until you feel a gentle stretch in the front of the hip of the back leg. That small posture cue lengthens the hip flexors that often pull the pelvis forward and feed tension. None of this is dramatic. All of it is doable. Let's talk about the mental side. Your body listens to your story about it. If your story says, "I am behind, I am late, I am losing," you activate stress chemistry that tightens the very muscles we want to relax. If your story says, "I can send my body clear signals," the chemistry shifts. During the routine, repeat a simple phrase silently: soften on the breath. Those 4 words are instruction, not wishful thinking. Many men find that this minute becomes a daily micro-practice of attention that spreads into other parts of life. When frustration rises in traffic, you remember the feeling of the exhale. When you face a difficult conversation, you remember the gentle lift of the perineal tissue and the sense of control that came with not forcing anything. These are not big philosophical moves. They are physical anchors that change behavior without strain. Some men ask whether this kind of massage can help with lingering discomfort from long cycling sessions, extended sitting, or periods of high stress. The answer is that it can support recovery by improving local circulation and reducing protective guarding. If you spend hours on a bike, think of this minute as your balance. If you are at a desk all day, think of this minute as your counter message to the pelvis. If stress has been your background music for months, think of this minute as the pause between notes that lets the music breathe again. To keep the experience safe and effective, let me offer precision cues for pressure. On the lower belly, imagine pressing a grape without breaking it. Enough to feel, not enough to bruise. On the inner thigh, imagine smoothing out a wrinkle in a piece of silk. On the perineal lift, imagine supporting a soap bubble so it rises, not poking a button to make it click. On the gluteal circles, imagine polishing fog from a mirror. These images help your hands find the right force. The body responds to intent conveyed through touch. When your intent is to soothe and restore glide, tissue obeys. What results should you expect and when? In the first week, most men notice subjective changes, less heaviness in the lower abdomen, a calmer urge pattern, or a surprisingly steady mood after showers. In the second to fourth week, you may find objective changes. Fewer bathroom trips driven by tension, more comfortable sitting, and a more natural sense of warmth in the pelvis. Over months, your posture adapts. Hips move with more ease, and your stride feels smoother. These are the kinds of quiet improvements that enhance daily life in ways you only notice when they are gone. They are also the foundations of intimate well-being, because a body that feels safe and well supplied with blood is a body that trusts itself. If you want to turn this into a 21-day reset, make a tiny chart on a sticky note. 3 columns for week 1, week 2, week 3. Each day you complete the minute. Draw a short horizontal line. At the end of the week, you'll see a ladder of lines that looks like rising steps. That visual proof is not childish. It is a neurological reward. Your brain sees completion and releases a little dopamine that makes the next completion more likely. Habits build not from perfect willpower, but from small victories captured in plain sight. There are also smart ways to adapt the routine if you have limited mobility. If standing is uncomfortable, sit on a shower stool with your feet planted and a towel under you to reduce friction. The steps remain the same: lower belly, inner thigh, perineal lift, gluteal edge, breath. If reaching the perineal area is difficult, hold the warm washcloth there for 10 seconds and let breath do more of the work that day. If shoulder mobility is limited, skip the gluteal circles and focus on breath-led relaxation. Remember, this is not a test of flexibility. It is a message of safety. Send the message with the options you have. Because we are talking about the pelvis, let's mention posture and sitting, since most of us spend hours in chairs. When you sit, imagine that your pelvis is a bowl of water you don't want to spill. Tilt it a degree forward so the water would pour slightly toward your navel, then settle in the middle. That subtle position unweights the tailbone and lets the pelvic floor sit in a neutral place. If you find yourself perching on the edge of the chair, set your feet flat and let your ribs float above your pelvis. These small cues prevent the constant backward tilt that makes the floor tighten and the lower back compress. Your minute in the shower will work better if your chair supports your effort instead of fighting it. Men often ask, do I need to do more than 1 minute to see real benefits? Short answer, the minute is the minimum effective dose for many. If you want more, add a second minute at the end. Repeat the perineal lift and the lower belly hold, then finish with 3 slower breaths. 6 seconds out, 4 seconds in. But do not skip the daily practice, because you think more is always better. In this strategy, the habit is the hero. A small act you do every day will outperform a long routine you do twice a month. Let's address confidence in the couple, because intimate well-being is not just anatomy, it is relationship. When you feel more comfortable in your body, you become more present. Presence changes the tone of conversations, the patience you bring to small frictions, and the clarity with which you express needs and boundaries. Many men report that once tension in the pelvis eases, they feel more grounded in the moments that matter. That groundedness communicates something quiet but powerful. I am here. You don't need to declare it. Your posture declares it for you. Your breath declares it for you. The nervous system of the person you love reads your calm like a lighthouse signal. Calm is contagious. You might be curious about complementary habits that support the same goal from the inside. 2 are simple and effective. First, a consistent sleep window. Going to bed and waking up at similar times stabilizes hormones that influence energy, mood, and vascular tone. Second, a walk of 10 minutes after one meal of the day. That post-meal walk helps your body handle glucose smoothly, and stable glucose means steadier energy for everything you care about. None of these ideas replace the massage. They amplify its effects by reducing the load on your system. Some men hear pelvic massage and worry it sounds complicated or inappropriate. Remember, this is a health routine. You are caring for muscles, fascia, vessels, and nerves that work hard for you. You are not pushing through pain. You are not attempting to create dramatic sensations. You are practicing respect for a zone that often carries stress silently. This is the same philosophy you would take to a stiff neck or a tight calf. Warm, breathe, gentle pressure, release. We simply apply it to the part of the body that many of us ignore. If you are an athlete or someone who trains with weights, this minute can become part of your recovery. Heavy lifts ask the pelvic floor to brace. That is normal and useful. But if the floor never gets the cue to relax afterward, you collect tension as hidden fatigue. A minute in the shower on training days tells your system, "Great job bracing. Now we return to neutral." Athletes who adopt this often find that hip mobility improves and that deep core work the next day feels more connected, not forced. If you have a desk job, consider pairing this with a standing break twice a day. Every 3 hours, stand, unclasp your hands, and shake each leg for 5 seconds. That micro break reduces the baseline tension that your shower routine will address later. Small inputs add up, especially when they point in the same direction. Let's make the steps unforgettable with a simple phrase. Warmth, belly, thigh, lift, glute. Breathe. Repeat it once now. That sequence is your map. Warmth prepares, belly releases the front line, thigh calms the side anchors, lift soothes the center, glute frees the back edge, breathe integrates the whole. 6 words, 60 seconds, one body that thanks you. You might ask how this supports longevity. Longevity is not only about years, it is about function. A body that circulates well, digests calmly, rests deeply, and moves freely will give you more high-quality years. Pelvic health contributes to all 4. When the pelvic floor coordinates with your breath, your core pressure normalizes, which helps your spine. When sitting is comfortable, you are more likely to remain active. When the center feels safe, stress chemistry quiets and recovery improves. Each of those outcomes is small on its own. Together, they are the math of aging well. Let me leave you with a few inspiring snapshots that mirror what many men experience. A man in his late 50s who works in finance told me he felt a constant urge to adjust his posture in meetings because of a dull pressure he couldn't name. 2 weeks after adopting the 1-minute routine, he realized he had just finished a 3-hour presentation without thinking about his seat once. A teacher in his 60s, who cycles on weekends, noticed that the familiar post-ride heaviness faded faster, and his sleep on cycling days improved. A grandfather in his early 70s described it this way: "My body feels less armored." That word, armored, captures what this routine aims to soften. Armor protects in battle. It exhausts in daily life. Trade some armor for coordination and watch how many things become easier. Here is your plan for the next 7 days. Day 1, practice the sequence slowly, without judging whether you're doing it right. Day 2, repeat and shorten the pauses between steps. Day 3, notice the breath more. Day 4, add the hip opener after the shower. Day 5, place your shoes by the door as a reminder to take that 10-minute walk after lunch or dinner. Day 6, pay attention to how you sit for 2 minutes every hour. Day 7, reflect for 60 seconds on what changed. You are not chasing perfection. You are building a relationship with a part of your body that quietly shapes how you feel. If there is one sentence I want you to remember, let it be this: your body is responsive, not stubborn. Give it a calm signal every day, and it will answer in ways you can feel. The 1-minute pelvic massage in the shower is that signal: warm, respectful, and effective. Try it tonight, then try it tomorrow. Pay attention not only to the area you touch, but to the ripple effects: steadier mood, easier sitting, a lighter lower back, a gentler rhythm with the person you love. Those ripples are the language of vitality returning. If this message resonated with you, put it into practice and watch your week change shape. Share your experience with someone who might benefit. And if you want more clear, science-based guidance for men's well-being, intimate health, and longevity, always practical, always respectful, stay close. Your body still has extraordinary potential. It is waiting for small, consistent signals. Give it 1 minute today.